Have you been told that your child has hypermobility joint syndrome? Do you know that there's a difference between hypotonia and hypermobility joint syndrome? Hi there, it's Neesha from My Favorite Physio. In today's video, I'm jumping in to talk about the diagnostic criteria for hypermobility joint syndrome. The reason why I'm doing this video is because we have recently seen a few children come through our clinic here at My Favorite Physio whose parents say that they have been told by occupational therapists that their child has hypermobility joint syndrome. Yet when we assess their child, the child does not fulfill the criteria for hypermobility joint syndrome. Instead, they are more fulfilling the criteria of hypotonia, which is generalized low muscle tone versus being double jointed. So having the wrong diagnosis would mean your child may be inappropriately or incorrectly treated because the therapist hasn't quite understood the cause for their low muscle tone or for their delayed gross motor skills, their delayed fine motor skills, and in some cases, delayed speech and language skills as well. Having the wrong diagnosis and giving the wrong treatment will actually impact a child's outcomes in the short to mid-term and even longer term outcomes. So I'm jumping in to talk about the criteria we use to diagnose hypermobility joint syndrome. It's a criteria called the Beighton criteria. It looks at 9 joints. So basically we look at your thumb joints. To be considered hypermobile in your thumb joint, you have to be able to get your thumb to touch your forearm. And I can't do so, so I'm not hypermobile. If your child can do so, that's 1 point per thumb. The next joint we look at is the little finger. If your little finger can bend backwards past 90 degrees, then you get a point. And I can't, so I don't get that point. But, you know, kids who are hypermobile could really get their finger down past that point. And that would be 1 point per little finger. The next joint we look at is the elbow joint. If your child can straighten out their elbow so that their elbow is beyond that straight, so that their forearm seems to go lower, they would be hypermobile in their elbow joint. They get 1 point per elbow. Then we look at their knee joints. If they can stand and push their knee backwards so that their knee is past their ankle at more than 10 degrees past straight, they would be hypermobile in their knee. And again, 1 point per leg. Finally, we get little ones to stand with their feet flat and tell them to bend down forward, place their palms on the ground. If they can do so with their knees straight, that means they get 1 point and they are hypermobile in their hip joints going forward. A child needs to get more than 4 out of those 9 points to be considered to have hypermobility on the Beighton criteria. On top of that, a child must have complaints of multiple joint pain for more than 3 months in more than 4 joints. Most children we see don't complain of that in any joints, and they don't fulfill the criteria 4 out of 9 on the Beighton criteria. So for those reasons, these children don't actually have hypermobility joint syndrome. There are a handful of other smaller criteria that we can look at, including skin extensibility, tendinitis, dislocations, and even organ prolapse. But in many of these children, these criteria don't actually even count for them. So they don't have organ prolapse, they don't have hernias, they don't have tendinitis, they don't have bursitis, they don't have droopy eyelids, they don't have dislocations in their joints. So for those reasons, those children definitely do not fulfill the criteria for hypermobility joint syndrome. So if you've got a child at home and you have been told that your child has hypermobility joint syndrome, why don't you try out that test with them? And if you're concerned about your child because they are floppy, or they're tripping over, or they're delayed in their gross motor skills and fine motor skills, and even their speech and language skills. Why don't you ring us here at My Favorite Physio? Speak to one of our expert pediatric physiotherapists. The number to ring is 02-9790-4233. And if you know somebody out there whose little one's been told that they have hypermobility joint syndrome rather than hypotonia, why don't you like and share this video with them? Until next time, have a fantastic day. Bye.